This is not easy for me to be talking about racism and discrimination, and then I know that it's not going to be easy for many of you to hear what I'm going to say. So if any of the stuff that you're about to hear makes you uncomfortable, I'm going to say that then I'm doing my job. Because you have to be uncomfortable with the stuff I'm going to talk about. It's uncomfortable to talk about white privilege. It's uncomfortable to talk about white supremacy. And it's uncomfortable to talk about what we can do to address these issues and really talk about health equity. So I'm actually going to begin in talking about my personal story. And I shared it a little bit in the previous session that we had, but I'm actually formally undocumented as of like 4 years ago, so I have adjusted my status. But I came to this country when I was 3 years old from Mexico. My parents came here because of just the economic situation in Mexico during the 1990s. And I grew up here like most young people who are undocumented without really realizing what it meant to be undocumented. I mean, I knew I was undocumented. I just didn't know how it would affect my adult life until, everyone goes to college and gets a driver's license. And so I started organizing very, very young. I started organizing with some of what we call the veteranos, the veteran dreamers, back in 2001, 2002, around health, education equity, and ensuring that we all had access to the university and that we paid in-state tuition. So a lot of that organizing, I really came out of the immigrant rights movement. So the health world for me is fairly new, but I'm just as passionate, and I think it's very important to me. And the reason for that is that as an undocumented person, my family experienced what it was like not to have access to health care. In fact, my mom was diagnosed with Parkinson's disease at a very young age of 37. And so we, as an undocumented family, we had to pay out of pocket. My mom often did not have access to specialty care. And so that has had detrimental consequences to my family even today. So I'm very, very passionate about this issue and can tell you firsthand what it's like not to have access to healthcare. So a little bit about Cipc, the California Immigrant Policy Center. We're a statewide organization in California that advocates on behalf of California immigrants. We seek to inform the public in the public debate about policy decisions that affect California immigrants. We do a lot of technical assistance. We do a lot of organizing with our coalitions, and we really see our work as from the ground up. We don't do any policy or advocacy without the input of the immigrant community, and we have a very collaborative way of doing that. So to begin our presentation, I really want to give everyone a quick and really, really quick historical look or provide some context into what healthcare for people of color have looked like. And I'm going to be sharing some examples of that. And I can list you whole things of that healthcare looks like for communities of color. But I do want to start with Hippocrates. Do folks know about Hippocrates, right? He's like known as the father of Western medicine. He really moved medicine from this idea that folks were ill or that illnesses were brought because of magic or because the gods were upset at you, and we moved it into this what they call modern medicine, that illnesses were caused naturally, and he extended clinical observations into like family history and environment. And most folks folks that are physicians know about Hippocrates and also service providers. What is not mostly known about him is that he actually built upon this idea that there are race and biological differences between whites, European whites, and people of color. For example, he shared this idea that the Asian population was much weaker than the white European populations. And so what we saw during the 19th century is that there was differences between races that were usually assumed to be biological and that were interpreted to show the superiority of white races that we can see and all that we can see even to today. So to go a little bit further, what we've seen now is that what we saw, especially during the colonial era, was the experimentation and treatment of slaves. And this is actually really well known that a lot of medical experimentation were done on plantation slaves that were seen, and it was actually seen as profitable. A lot of plantation owners or even individuals who purchased slaves, they purchased it for the purpose of experimentation and to profit out of Black bodies. There were a lot of physicians actually bought slaves to be able to do experimentations to treat illnesses that would benefit the white race. So, and this is very much documented throughout that era. But we also saw that that this continues to happen even in the post-slavery and even today, with the lack of healthcare access for communities of color and for whites and immigrants. So I would love to, I'm going to bring up another case that really highlights the experimentation that has been done and continues to happen even till today. In 1932, the Public Health Service, working with the Cipc Institute, began a study to record the natural history of syphilis. Has anybody heard about this, right? We all know this, right? But, and what happened during that, during that study? It was called the study of the Tuskegee study of untreated syphilis in the Negro male. So during the study, it involved 600 Black men, 399 with syphilis, and 201 who did not have the disease. The study was conducted without the benefit of the patient's informed consent, and researchers actually told the men that they were being treated for bad blood. So a local term used to describe several ailments, including syphilis. In truth, they did not receive the proper treatment needed to cure their illness. In exchange for taking part of the study, the men received free medical exams, free meals, and burial insurance. So although the original projected project lasted 6 months, the study actually went on for 40 years. And so what we saw with this study is that Black bodies have been seen as disposable, right? As less than their white counterparts. And were seen as disposable because they were not told of their patient rights. They were not told of what the procedures will look like, and were treated as if they were sort of animals or these tests that you can just run, right, without any sort of consent. So during the early 1900s, and I don't know if most folks have heard about this, there was a huge sterilization that was done on women of color. And I'll particularly talk about LA County, but throughout the 1900s, thousands of poor women, mostly women of color, in at least 30 states were unknowingly sterilized after giving birth as part of the federally funded program that aimed at population control. In California, which accounted for a third of sterilizations, many of these women were Spanish-speaking immigrants. And there's actually a film called No Más Bebés, I don't know if folks have seen it, No More Babies, that actually highlights the sterilization that happened with the LA County USC Medical Hospital, where these women were not told that they were actually being sterilized after giving birth. Many of them were told they had to sign papers or their babies would die. And actually, a lot of them didn't even know until years later when they were trying to continue with their family. And there was a huge lawsuit that happened. They didn't end up winning, but this continues to be, California continues to deny this and doesn't recognize that this happened to these mostly immigrant women in LA County. And like I mentioned, this was mostly conducted by the LA County General Hospital. And also, during the 1940s, we had the Bracero program. I don't know, most folks know about the Bracero program. Actually, my great-grandfather was part of the program. I also just found out. But this was a worker program between the U.S. and Mexico, where there was a shortage of labor during the World War II, and so they wanted to bring in Mexican laborers that would, would fill these roles. So what folks actually don't know is that the Bracero program, it had 4 million Mexicans came to the U.S. to work under this program. But officials required that every bracero, every prospective bracero, would undergo a physical examination with chest x-rays to check for tuberculosis, and then also to check for diseases and other psychological profiling, and also had to take a chemical bath. So they tested applicants to see whether they were capable of artist labor, expected of them. So they would check their hands to see if they had calluses, and they would put their bodies under different tests. And sometimes if they had scars or recent injuries, they would potentially be disqualified. So throughout these different cases, we're seeing how communities of color have been treated and how they've been able to receive care, right? And it hasn't been the most welcoming, and actually, in fact, has been very damaging to not only their bodies, but to their communities and their access to quality and affordable healthcare, and access to any healthcare at all. I mean, even the immigration process, for those that have gone through that, when you go through the immigration process, they actually ask you to take a physical exam, and they check you for tuberculosis, they check you for all these different things that can potentially disqualify you from the process of adjusting your statuses. So, this is what we continue to see. So, sorry, I need water. So where do we stand today? So what we actually see is the U.S. healthcare system that really has been defined and continues to live and thrive under racism and discrimination. So, for example, the type of healthcare access that you receive really depends on your immigration status, depends on your income, it depends on where you live. I'll give you the example in California. We call what the care that immigrants receive, we call it Band-Aid care, and we call it a patchwork of care, because really wherever you live in California depends what kind of healthcare you receive. If you're in LA, you have a good program, but if you live in like the central part, which is mostly the Central Valley, a lot of farm workers live there, your access to healthcare is very limited. So really zip code and income really matters. We've seen the barriers to hospital and access to quality of care. We see racial disparities in medical treatment, and there is a lack of data and standardized collection of methods. In fact, many states do not collect data on language access or even ethnicity or race, and it's really, really important to do that to understand what the understand health equity or understand health disparities and where the needs need to be met. So I'll give you two cases of, so how do disparities impact people? So I'll give you the study of two Baltimore neighborhoods, Little Italy and Canton. Has anybody heard about this study that just came out, I think, in May? So the Little Italy and Canton are two nearby neighborhoods in Baltimore. So they're about 1.5 miles apart from each other. They're 7 minutes by car or a half an hour walk. But a newborn baby, but for newborn babies, the neighborhoods couldn't be farther apart. So kids born in Little Italy are more than 10 times as likely to die before their first birthday as those born in Canton. So in Baltimore's Little Italy neighborhood, about 2 out of every 100 children die before their first birthday, which puts infant mortality in Little Italy roughly to par with Nicaragua. So that's the type of healthcare and the mortality rate we're seeing even in our own nation, right? And we're actually one of the nations that spends the most on healthcare, right? What's the number look like now? Yeah, it's just like, it's astronomical, right? And just to be able to compare what's happening in Little Italy and Baltimore to what's happening, and to see that same infant mortality as Nicaragua, it's very shocking, and we should be really appalled by that. So so this is just a quick graph to show you what that difference looks like between these two neighborhoods in Little Italy and Canton. So like I mentioned, this is where you can clearly see why it's where you're born or where you live, it really determines your health outcomes. So this is a little bit more on other countries that compares the Baltimore neighborhoods to other countries as well. So in California, so I'll just quickly add the California piece since I'm located in California. But in California, even life expectancy can vary dramatically. So white men actually live about 7 years longer than African American men, and we actually see this in LA, where South, the comparisons between South LA and the West LA, Brentwood, Beverly Hills, I think there's about a 10-year gap for males. So, and those different neighborhoods are like, well, they're 12 miles apart, but, with traffic, it can be very long. But, it's just, it just really shows you that neighborhoods that are not that far apart, it really is difficult. You can really see what the expectancy of life is. And even South LA is actually considered a healthcare desert. I know I was talking to someone about that, about just like not being able to have community clinics or even hospitals in your area. In fact, one of the very controversial hospitals that was closed down was the MLK hospital. That was, it's a huge fight, but anyway, I'm not gonna go into that, but we can definitely see that even in South LA. So now we're in this post ACA, right? Now we've been able to, people have coverage, people have been able to get healthcare, and this was the promise of the ACA, right? That everyone would have access to healthcare, that it would be affordable, that it would have a comprehensive of services, that no one would be denied because of pre-existing condition. But what we actually seen in California is that people of color represent 60% of the California population. So and most of you have probably heard, California is a very diverse state. It's home to about 2.7, close to 3 million undocumented Californians. We actually have the highest number of undocumented people in the whole nation. So our state really is home to many, many undocumented people. But 75% of the uninsured, but it represents 75% of the uninsured in California currently. So we represent 60%, but we are 75% of the uninsured. And then out of the nearly 1.5 elderly adults to be newly eligible for Medi-Cal, 2 out of 3 are people of color. We have seen, that there's health insurance that don't discriminate or can't deny you a healthcare plan because of a pre-existing condition, but we continue to see multiple challenges with communities of color and immigrant communities seeking healthcare. In fact, even our own marketplace, Cover California, has done little investment in outreach and education efforts for the African American community. And we've seen very, very low numbers of those African American communities enrolled in a health plan. And in fact, they do make one of the highest uninsured populations in our state. So the failings of the ACA, I won't go through it because I'm sure we can have a whole list of this. Of the failings of the ACA, but it's not universal healthcare coverage, right? It's not the solution to getting people healthy and to have people have healthcare. In fact, my parent, a lot of the new people that are getting health insurance, it's new for them. It's very, very new to them. Specifically for immigrants, undocumented immigrants or immigrants overall are not used to seeing healthcare as a human right. Actually, they don't see it as a human right. They see it as a privilege. Healthcare has been a privilege to those that have higher incomes, those that have legal status, and those that may be employed. And so for a lot of immigrant families, when we started organizing, they don't see healthcare as a human right. And you can tell them many times that healthcare is a human right, and they should be able to walk into community clinic or a department and get healthcare access, but that's not the situation. People are actually being denied care. There's deportations and raids that are happening throughout our nation, so they don't see that this type of access is for them. So I'm actually going to go into a little bit more about our Health for All work that we've done in California, and this Health for All work has been as a way to break down barriers for healthcare access for California residents. First of all, California has taken great steps to integrate immigrants. We just passed a driver's license AB 60 law, which means that undocumented people in California can access driver's license. And more than actually 500,000 have already received the driver's license in our state. We've passed protections for workers, anti-retaliation, verify bills. We've actually passed professional licenses for immigrant youth. And then lastly, we just expanded full scope Medicaid to undocumented children in our state. So what that has looked like is that when we started this campaign 2 years ago, and as folks were getting excited about the ACA, excited that we actually expanded our Medicaid program, we were saying, where are the undocumented people? What are we going to do to make sure that they're included in part of these expansions? So there's a UC Berkeley Labor Center study that actually said that even after the full implementation of the ACA, even after we expand our Medicaid program, there would be about 2.7 or 3.4 million Californians that will remain uninsured, and about 1.4 to 1.5 would be undocumented Californians. And the reason for that is that undocumented people are explicitly and unjustly excluded from the ACA and from full scope Medicaid. So even if they wanted to purchase a health plan, even if they wanted to enroll for, they can only get emergency Medicaid, they're not able to do so. And we know that emergency health care can only go so much. So like I mentioned, this what we've seen is a patchwork of care for the undocumented in California. So we did start this campaign about 2 years ago, and we actually started it with an docu-caravan. And to talk a little bit more about the campaign, when we initiated, we really wanted to make sure that we were leading with the immigrant rights perspective, with the immigrant rights community. We wanted to make sure that this movement was built upon from the ground up, that the undocumented community were at the forefront, not only sharing their stories or doing actions or even talking to legislators, but that they were actually part of the table and discussing strategy, and we're at the table discussing how do we move our health for all movement forward. So it was really important to engage the immigrant community because, like I mentioned, for the immigrant community, just telling them that healthcare is a human right wasn't enough. Healthcare for them is a privilege, and we had to acknowledge that and go through that process, right? So we did an docu-caravan that traveled throughout our state, that went through different counties, and we either had a community forum or we had a community dialogue and talking about healthcare access. So then you see all the pictures of the actual van and all the community events that we started doing. We really felt, like I mentioned, that it was important to be able to uplift immigrant voices and work with them hand in hand. So we had a bill that was introduced by Senator Lara in this year, and this proposal ensures that undocumented children in our communities would have access to quality and affordable health care. Like I mentioned, it was just signed by our governor on October 9th. So beginning May 1st, 2016, undocumented children in our state will have access to full scope Medicaid. I also must say that, and I have to acknowledge the wonderful work that was done in our state with our immigrant rights folks and our health advocates coming together and creating a meaningful and strong partnership to passing this issue. We knew that it wasn't, that we just couldn't do this alone, and that we needed to have true partnership between the immigrant rights folks and the health advocates. So it's been really great to be working with both these coalitions and coming together on an issue that really matters not just to immigrant families, but that matters to everyone. So I would just say our next steps, our work is not over. We want to make sure that we ensure that we give healthcare to the parents of the undocumented children, and that we expand our Medicaid program to undocumented adults as well. So we have a long journey ahead of us, and we actually need to continue with the momentum that we have built and increase our capacity, because we know that it's going to be very difficult for us to get healthcare coverage for adults. We know our campaign for children I mean, it wasn't, I was actually quite surprised that we were able to move so quickly. But I mean, it's in California, when we talk about children, legislators, our governor are much more open to hearing that. And, you know, to hear, I mean, who's going to say no to a child, right? With the, well, there will be who actually says no to child. Actually, but in our state, we, you know, it was, we moved a lot of legislators to supporting the kids. But when it comes to adults, it's just, you know, it's really difficult, and we know we have a long journey ahead of us. So, what can you do to help and advance policies that benefit immigrants and other communities of color? I say join us. Let's come together and work as one. I want to see next year and the year after that for this room to be very diverse. I want to see young people. I want to see immigrant families. I want to see workers. I want to see jornaleros and people, patients and people on the ground that are here with you, joining hand in hand. But we got to do this together. And you, and as I'm here today to share with you my work, you also need to come to us and share your work so we can start working together. Support our efforts to fight racial profiling, excessive use of force, and unjust detention and deportation. This is really, really serious. We are in a time where, you know, our young people, and particularly young Black women, are taking leadership in this Black Lives Matter movement. Actually, the Black Lives Matter movement was founded by 3 young African American women, and it's time that we follow their leadership and we support and join their efforts. And we start talking about racism, we start talking about discrimination and white supremacy that's in our healthcare system. And so I invite you all, like I said, to join us in our fight for unjust detention and deportation as well. We've seen a massive deportation of undocumented people, more than any other, more in the Obama administration than any other administration. I also invite you to support our state funding. We need to fund our state counties to support healthcare programs. We need to support our community clinics that sometimes are, you know, running on donations, and we need to, because sometimes that's the only form of healthcare that many people of color and undocumented immigrants have access to. So, and lastly, so how do we move forward to ensure the positive health outcome for all? Like I said, we need to really come together and break down the system founded on white supremacy. We need to really check our privilege. We need to really acknowledge that our population is going to be changing. And actually by 2015, I don't know if folks have seen this data, but by 2015, the majority of our population in our country is going to be people of color. 2060, right? No, I heard 2050. Yeah, right, okay. So I invite you all to really think about who the services are being provided to, and who's benefiting from healthcare access. Also, it's important to call out your friends or neighbors or family that need to see these issues through a more progressive lens. So we really need strong white allies to be calling out racist acts, or when people are saying things. We need to, because it's, like I said, it's a very heavy work for people of color, and really we should be able to do this together. So, and then lastly, really valuing the health and safety of everyone. So I'll end there because I know I'm over my time, and I know we have another speaker, but thank you everyone, and this is my information.